Welcome to the deep dive.
We live in a digital world absolutely brimming with tools, health apps, fitness trackers, all that productivity software.
Yuck. Tons of them.
We download them, maybe try them for a bit, and then, well, often they just end up collecting digital dust on our phones.
Happens all the time.
But what if we could actually predict what you, the user, truly value in these digital products before they're even fully built?
That's the million-dollar question, isn't it?
Today, we're taking a really fascinating look at a powerful research method designed to do just that. Understanding how people make choices, specifically about digital health products.
Right.
We're dissecting something called Discrete Choice Experiments, or DCEs. We're using a fantastic methodology tutorial that dives into a real-world example, figuring out what actually drives people to use smoking cessation apps.
And it's such a critical area. Because honestly, despite the potential of all these digital health tools, their actual uptake is often surprisingly low.
Really? Why is that? Well, it's complex. And just observing behavior isn't always enough to understand why users pick one product over another, or none at all. This deep dive will show you how researchers systematically try to uncover those hidden preferences.
Okay, so our mission today is to give you a clear understanding of how these, intricate experiments are actually built, what kind of insights they reveal, and why they're becoming such an indispensable tool for anyone looking to create digital product that people genuinely want to use.
Exactly. They offer a structured way to understand those trade-offs.
All right, let's unravel this.
Let's do it.
So let's start right at the beginning. What exactly is a discrete choice experiment? It sounds pretty scientific, maybe a bit intimidating.
Well, it is scientific, but the core idea is actually quite simple. A DCE is what we call a stated preference method.
Stated preference, meaning you ask people.
Exactly. Instead of trying to guess what people want or just observing choices, which, like we said, can be really tricky for new products, we ask them directly. It's based on this economic idea that individuals make trade-offs when making any decision. They'll choose the option, the alternative, that offers them the greatest overall utility.
Utility, like usefulness or benefit.
Benefit, value, satisfaction. It's the overall package. So we're essentially asking people to tell us their preferences by making choices in these carefully controlled hypothetical scenarios.
So it's about getting ahead of the curve then. Predicting what might work before it even exists in the real world.
Precisely. Think about it. Observational data is often completely unavailable for brand new products or services.
Right, there's nothing to observe yet.
Exactly. So DCEs give us an empirical way to move beyond just relying on, say, expert opinions or guesswork.
Which can be hit or miss.
Very hit or miss.
Yeah.
Plus, DCEs allow us to account for complex interactions between different aspects of a product, things that might get overlooked otherwise.
Okay.
And while this methodology actually started out in marketing and transport economics way back in the early 80s.
Oh, really? Not health?
No, not initially, but now it's really widely adopted in health and healthcare settings, including, addiction research and, crucially for our chat today, digital health.
That seems like a huge deal, especially for digital health, where getting users to just adopt and stick with a tool is such a massive hurdle.
It really is.
You mentioned a case study. What specific challenge were they trying to tackle with these smoking cessation apps?
So the tutorial we're following, it used DCEs to really understand user preferences for smoking cessation apps. The big question was, how can we best present these apps on, say, curated health app portals?
Like an app store just for health apps?
Kinda, yeah. Think of curated lists or platforms. The goal was to figure out how to present them to actually increase their uptake. And uptake means getting users to select them, download them, and actually install them.
Got it. So not just looking pretty, but actually getting used.
That's the goal.
All right, so if I'm a developer or maybe a designer, and I want to build an app people will genuinely engage with, where do I even begin setting up one of these experiments? It sounds complex.
It involves several steps, for sure. But the first, and arguably the most critical one, is identifying the relevant attributes.
Attributes. Okay, what are those exactly?
These are the key characteristics or features of the product or service you're studying. They can be quantitative, like, a specific price.
$2.99 a month.
Right. Or they can be qualitative, like the overall design aesthetic, or maybe who developed the app.
Okay, this sounds like where the careful detective work really comes in.
Right.
How on earth do you decide which attributes to focus on? I mean, you can't possibly include every single detail of an app, can you?
Oh, absolutely not. And that's a key challenge. Trying to include too much just confuses things.
Right.
So identification usually starts with a really comprehensive literature review. see what's already known, what factors usually pop up.
Standard first step.
Then, crucially, it's followed by rigorous qualitative research, things like in-depth interviews or maybe think-aloud studies, where you watch potential users interact with mock-ups and they talk through their decision process.
Ah, so you're getting direct user input early on.
Absolutely essential. This ensures the attributes you pick are genuinely relevant to your target audience, not just what you think is important.
Good point.
And there's also the practical side, managing cognitive load for participants. If you present too many attributes or choices, people just get overwhelmed and don't make meaningful trade-offs.
Their brains just shut down.
Basically, yeah. So the literature generally suggests including fewer than 10 attributes. Ideally, maybe 5 to 7 is a good range to aim for.
Okay, 5 to 7 key things.
Yeah.
So what did they actually land on for the smoking cessation app study? Which attributes made the cut?
Well, for that study, they started with a longer list, I think around 14 potential factors influencing app uptake, which they got from a systematic review.
Okay.
But then they refined that list down through their qualitative research, talking to potential users. They ultimately selected 5 key attributes.
And those were?
Let's see. The monthly price of the app, who developed the app, was it a university, a health organization, a commercial company?
Okay, trust factor maybe.
Potentially, yeah. Then it's star ratings, the actual description of the app shown in the portal, and finally, the images shown alongside it.
Interesting mix. Price, developer, rating, description, images.
And these were chosen partly because the qualitative research showed they were important to users, but also because they were things that could be easily measured and presented within the experiment itself. Practicality matters too.
Right, you have to be able to actually show these variations. So once you have these core attributes, what's the next layer of detail? You mentioned something earlier.
Yes, the attribute level.
Levels, right.
These are the specific variations or options within each attribute. So for example, if monthly price is your attribute.
Like we said, $2.99.
Exactly. The levels might be, say, $0, so free, then maybe $2.99, perhaps $5.99. Those are 3 distinct levels for the price attribute.
Okay.
And the range of these levels is really crucial. If the differences between them are too small, let's say you compared an app costing $2.99 to one costing $3.
Yeah, I probably wouldn't care much about that difference.
Precisely. Participants might not perceive a significant trade-off, and they'd essentially ignore that attribute altogether. You need enough variation to actually make people think and make a choice based on that attribute.
That makes perfect sense. A tiny difference in price, or maybe even star rating, probably wouldn't sway my decision much at all. Needs to be noticeable.
Exactly right. And for the case study, they actually took an extra step. They conducted a small preliminary survey with about 34 participants specifically to refine these attribute levels, especially for things like monthly price and star ratings.
Oh, interesting. What did they find?
Well, one example they give is with star ratings. They discovered that the difference between, say, 4.8 stars and 4.7 stars wasn't nearly as impactful or relevant to users as the difference between, say, 4.8 stars and 4.0 stars.
Ah, so that bigger jump matters more. Makes sense.
You can actually see the final list of the 5 attributes and their carefully chosen level laid out quite clearly in a table. It's figure 1 in the original source material they discuss.
Okay, helpful to visualize. So we've painstakingly picked our attributes, our features, and their specific variations or levels. Now, how do you actually present these options to people and get them to make choices in a way that gives you meaningful data?
Right, this is where the choice tasks come into play.
Trace tasks.
Participants are shown a series of these hypothetical scenarios. Each scenario typically presents 2 or more alternatives, essentially different versions of the product or service.
Like App A versus App B.
Exactly. And each alternative, App A and App B, is described using a unique combination of those attributes and levels we just talked about. So App A might be free, developed by a university, 4 stars with a certain description and image, while App B might cost $2.99. B from a company, have 4.5 stars, different description, different image.
Okay, so direct comparisons.
And the participant simply chooses the one they prefer in that specific scenario. Then they move on to the next choice task with a different pair of alternatives.
How many choices do they usually make?
It varies, but often between, say, 8 and 16 choice tasks per person. Enough to get data, but not so many. They get fatigued.
Right. And you mentioned the smoking cessation app study used full profile tasks. What does that mean?
Good question. Full profile means that for each alternative, like App A and App B, All 5 attributes were displayed simultaneously.
So you see the whole picture for each option at once.
Exactly. This is generally good for maximizing the information you get from each choice, especially when you have a manageable number of attributes, like 5.
Okay. But I can imagine, in the real world, sometimes you look at the options and none of them really appeal to you. You just kind of walk away, digitally speaking.
Yeah.
Does the experiment allow for that no thanks choice?
It absolutely should, and the tutorial really emphasizes this. It's crucial to include a neutral option, which is often called an opt-out alternative.
Opt out.
Yeah, something like neither of these or I would not choose either app.
Ah.
Including this makes the choices far more realistic.
Yeah.
It mimics that real-world scenario where you might just decide not to download an app if none of the ones on offer truly appeal to you based on their features and price, etc.
So it prevents forcing a choice when neither is good.
Exactly. And the smoking cessation app, DCE, they discuss, wisely included this opt-out option. If you were to look at Figure 2 in the source material, you'd see an example of what one of these choice tasks actually looked like to a participant, App A, App B, and the neither option below.
Gotcha. So clearly this isn't just a simple multiple choice survey where you pick your favorite color. There's a lot of underlying science, it seems, to how these choices are structured and then analyzed. What does that underlying science bit look like?
You're right. There's a lot going on under the hood. That's the experimental design part. It's a systematic method for generating those choice sets, the pairs of alternatives that get presented to respondents. The goal is to ensure you collect high-quality, informative data. And a key part of designing the experiment is specifying the analytical model you plan to use later for the statistical analysis.
The math part.
The math part, yeah. This often involves a framework called the random utility framework, and very commonly a specific model called the multinomial logit model, or MNL model.
Okay, random utility. Multinomial logit. Sounds complex. What's the basic idea?
Well, in simple terms, the random utility framework just assumes that people choose the option that gives them the most overall utility or satisfaction, like we discussed.
Right, the highest perceived benefit.
Exactly. And the MNL model is a statistical tool that helps us quantify how much each specific attribute and level contributes to that overall utility or choice. It lets us estimate the importance of each piece.
So utility isn't just about practical usefulness, but really the total perceived value or benefit. And this MNL model helps you crunch the numbers to see which specific features are driving that value.
That's a great way to put it, exactly.
Right.
It allows us to put a numerical weight or value on how much people seem to like or dislike each attribute level based on the choices they make across all the tasks.
Fascinating. What else goes into this experimental design phase?
Well, you also need to decide whether you want to investigate just the main effects.
Main effects.
That's the impact of each individual attribute level on choice. Like how much does price alone affect the choice? How much does star rating alone affect it? And so on.
Right.
Or you might want to look at interaction effects.
Interactions.
Yeah.
Meaning how attributes work together.
Precisely. How combinations of attributes affect choice. For example, maybe a high price is more acceptable if the developer is a trusted university compared to if it's an unknown company. That would be an interaction.
Oh, okay. That makes sense.
Yeah.
What did the smoking cessation app study focus on?
For their study, given it was quite novel research in that specific area, they decided to focus primarily on the main effects first, keep it a bit simpler to start. You also decide if it's going to be a labeled or unlabeled experiment.
Labeled versus unlabeled.
Yeah. Unlabeled means the alternatives are generic, like we said before, app alternative 1 versus app alternative 2. Labeled would be if you were comparing fundamentally different things, like choosing between an app versus a website versus phone coaching.
Okay, different categories.
Right. But for the case study, they used an unlabeled design because they were comparing different presentations of the same type of product smoking cessation apps, not fundamentally different categories of support.
Makes sense. Now, tell us more about this really intricate part, generating the actual structure of the experimental design. You said it involves heavy-duty math and stats.
It definitely does. It's all about efficiently generating the specific combinations of attributes and levels that will make up your choice tasks.
How so?
Well, imagine you wanted to test every single possible combination of the attributes and levels. That's called a full factorial design.
Every combo.
Every single one. But that's almost always completely impractical. It leads to a massive number of potential app profiles. For example, with their 5 attributes, some having 4 levels, some 3, a full factorial design would have resulted in. Wait for it. 432 unique app alternatives.
Oh, 432. No participant's going to sit through choices comparing all of those.
Exactly. You'd need thousands of choice tasks. People would just give up. It's totally infeasible.
Okay, so full factorial is out. How did they possibly manage to narrow that down?
They used what's called a fractional factorial design.
Fractional, maybe a fraction of the total.
Precisely. It's a carefully selected, smaller sample of all those possible alternatives. The key is to select this fraction, the subset, in a way that still allows you to estimate the effects you're interested in, but with way fewer choice tasks.
Okay, a smart sample.
Exactly. This reduced their potential options from 432 down to 96 alternatives, which they then arranged into 48 choice pairs or tasks for participants. Much more manageable.
Much more, so 48 pairs of apps to compare.
Well, they usually block those tasks, so each participant only sees a subset, maybe 12 or 16 pairs.
Okay. Even better.
Now, within fractional designs, there's another important distinction between older, orthogonal designs and more modern, efficient designs.
Orthogonal versus efficient? What's the difference there?
Orthogonal designs aim for complete statistical independence between the attributes, basically ensuring the level of one attribute doesn't predict the level of another across the choice tasks.
Sounds statistically pure.
It is, in theory, but modern practice, especially in health, increasingly favors efficient designs.
Okay. Why the shift towards these efficient designs? What's the practical benefit?
The main benefit really boils down to accuracy and power, especially when you have, say, 5 or more attributes. Creating a truly orthogonal design can become very difficult or might require too many tasks.
Right.
Efficient designs, on the other hand, are optimized to increase the precision of your results specifically, the parameter estimates for a given sample size. They aim to minimize the standard errors of those estimated coefficients we talked about.
So, smaller error margins, more confidence in the results.
Exactly. Think of it like getting a sharper picture. They use statistical criteria to select the choice tasks that are expected to give you the most information about the parameters you want to estimate.
Even if it means the attributes aren't perfectly independent.
Even allowing for some limited controlled correlation between attributes, yes. The most widely used measure of this statistical efficiency is something called the D error. You want a design with a low D error.
Lower D error means a more efficient, more powerful experiment.
Got it.
That's the gist of it.
That makes a lot of sense, basically, getting more accurate results from the same amount of participant effort. Now, are there different ways to make these efficient designs even smarter or more tailored? Yes, absolutely. It often depends on how much prior information you have or think you have about user preferences before you even run the main study.
Prior information, like hunches about what people prefer.
Kind of, yeah, but ideally, based on previous research or pilot data, if you have absolutely no prior information, you're going in totally blind, you might use what's called a Z-efficient design, where the Z stands for zero priors.
Okay, starting from scratch.
Right, but often you have some idea. Maybe from qualitative work or a literature review, you suspect that, for instance, a developer being a trusted university will likely positively influence uptake,
Makes sense.
and that a higher cost will probably negatively influence uptake.
Pretty safe bets usually.
Right.
Hmm.
If you have fixed certain values or at least directions for these effects in mind, you can use a DP-efficient design. The P stands for priors. You incorporate these assumptions into the design generation process.
You build in your expectations.
You do, and this can often lead to an even more efficient design, tailored to confirming or refining those specific expected effects. This is actually what they used for the pilot phase of the smoking cessation app study. They had some directional ideas.
Okay, so DP for the pilot. What about the main study?
For the final DCE, they often use what's considered the most robust approach, especially if you have decent pilot data. A D-efficient design, where B stands for Bayesian.
Bayesian. That sounds advanced.
It's a bit more complex statistically. Instead of assuming fixed prior values, it describes the likely parameters using probability distributions. This generally produces designs that yield even smaller prediction errors in the final model.
Wow. So more sophisticated assumptions lead to potentially more precise results.
That's the idea. So a common best practice now is often to start with maybe a DP-efficient design for a pilot study, use that pilot data to refine your understanding of the parameters, and then generate a DB-efficient design for the final main experiment.
Pilot with DP, refine, then main study with DB.
Got it. It's a good summary.
So you've gone through all this meticulous work, identifying attributes, setting levels, crafting choice tasks, using sophisticated stats to generate an efficient design. You've built this intricate experiment. Do you just launch it to thousands of people right away? Or is there like a dress rehearsal?
Oh, absolutely not. You always pilot the DCE first. A test run is crucial.
Always pilot. Why is it so important?
Well, piloting is incredibly important for several key reasons. First, it helps ensure that the information you're presenting in the choice tasks is actually clear and understandable to participants.
Makes sense. Check for confusion.
Exactly.
Yeah.
Second, it helps you gauge whether the choices feel realistic and meaningful to them. Are they actually making trade-offs or just clicking randomly?
Right.
And third, it lets you check that the experiment isn't too cognitively demanding. Is the number of tasks okay? Is the wording clear? It's your main opportunity to gather direct feedback from people similar to your final sample and make crucial amendments before you invest in the large-scale study.
Catch problems early.
Precisely. Fix things before it's too late or too expensive.
So what kind of insights did they glean from the pilot phase for that smoking cessation app DCE? Did they find anything surprising?
They did. Their pilot study involved 49 individuals, and they uncovered a really interesting and potentially problematic finding.
Oh, what was it?
With the initial order they had for presenting the attributes within each choice task, participants tended to kind of ignore the last two attributes listed.
Ignore them. Which ones were they?
They happen to be the most text-heavy ones, the app description and the images shown.
Whoa, but those seem really important for choosing an app.
Exactly. It was a huge red flag. It suggested these potentially crucial attributes weren't getting the attention or weight they deserved, probably because they came last and required more reading.
So what did they do?
Well, they wisely decided to change the order in which the attributes were presented in the final DCE survey. They moved the description and images up, mixing them in better to ensure all attributes received proper consideration from participants.
That's a fantastic example of how piloting can directly improve the quality of your final data. A simple change based on feedback.
Absolutely critical. They also used the pilot to confirm that the average survey completion time was under 12 minutes, which suggested that the number of choice tasks they were planning was appropriate and wasn't causing excessive burden.
Good practical check too. So piloting really helps refine the instrument. But once it's finalized, you run the main study, you get all this data. How do you know the data you've collected is actually reliable? That people were consistent?
That's a great question, and it leads into checks for internal validity.
Internal validity, okay.
These are checks designed to help you understand the consistency of the choices participants made. Were they making trade-offs in a somewhat stable way throughout the experiment?
How do you check that?
One common method is called a stability validity test, or sometimes a holdout task. Essentially, you repeat one of the choice tasks later in the sequence.
Show them the same choice again.
Exactly. You see, if participants make the same choice the second time they see that identical pair of alternatives.
Did they use that in the smoking cessation app study?
Yes, they did. They included a randomly generated holdout task by repeating the fourth choice task later on in the survey for each participant. And importantly, they excluded the data from this specific repeated task from their main analysis, so it didn't artificially inflate consistency. It was purely a check.
Okay, so it's just a test, doesn't influence the main result.
Right. Now, it's worth noting that while these internal validity checks are important for assessing data quality, someone inconsistently answering a repeated choice isn't necessarily a fatal flaw or a violation of the underlying random utility theory. People can change their mind, or maybe the context felt different later.
Okay, that's not black and white.
No, and there's actually no universal consensus in the field on whether you should automatically exclude participants who fail these consistency checks. Doing so could potentially introduce statistical bias into your sample.
By kicking out potentially real, albeit slightly inconsistent people.
Exactly. So what the researchers in the case study did, which is good practice, is they reported their internal validity data, how many people are consistent, but they chose not to exclude participants based solely on that check.
Transparency, but no automatic exclusion.
It's a balanced approach.
Okay, let's maybe zoom out a bit now. We've journeyed through this meticulous process of building a DCE, from attributes all the way to validity checks. Thinking big picture, what are the major advantages of using this method, especially for something as complex and, frankly, vital as digital health products?
Well, DCEs bring some really significant benefits to the table. A huge one is that they enable researchers to gain measurable quantitative insights in situations where that real-world observational data is just difficult or maybe impossible to obtain.
Right, like for apps that don't exist yet or behaviors that are hard to track.
Exactly, like understanding the factors impacting the uptake of new health apps before they're widely launched. DCEs help quantify user preferences to support really complex decisions. Such as planning which features to include in an app update to genuinely promote uptake, or how to design the presentation on an app portal, like in our case study.
So guiding development and marketing.
Precisely. And crucially, they can be used in entirely hypothetical circumstances. This allows you to measure preferences for, say, a potential new policy change or a whole new digital health system before it's actually implemented.
Like a policy simulation.
Kind of, yeah. It's much like how DCEs were used quite a bit during the pandemic to investigate public preferences for different designs of COVID-19 contact tracing apps, even before they were rolled out.
That's a great example, testing the waters.
And finally, the experimental nature itself is a benefit. Because you systematically vary the attributes, you get clearer insights into the marginal effect of specific changes.
Marginal effect, meaning the impact of changing just one thing.
Yeah, like how much does increasing the price by $1 actually decrease the probability of someone choosing the app, holding everything else constant? You can isolate those effects cleanly.
Okay, it certainly sounds like a powerful, versatile tool, almost like a crystal ball for product development sometimes. But, no research method is perfect, right? What are some of the challenges or limitations researchers face when using DCEs?
That's a very important question to ask. No method is foolproof. One really significant concern with DCEs is their inherent hypothetical nature.
Because the choices aren't real.
Exactly. The choice tasks present hypothetical scenarios, and this can lead to something called the intention-behavior gap.
Intention-behavior gap. What people say versus what they do.
Precisely. What participants say they would choose in a controlled hypothetical experiment might not perfectly align with what they would actually do when faced with a similar choice in the complex, messy real world.
That seems like a major caveat.
It is. And this raises fundamental questions about external validity.
External validity.
Yeah.
Meaning how well the results generalize to the real world.
Exactly. How well do the preferences we measure in the DCE actually predict real-world decisions and behaviors? Testing for external validity is actually quite challenging.
How challenging?
Well, the paper we're drawing from notes that in the broader healthcare field, only about 2% of published DCE studies actually report details of any external validity investigations.
Only 2%. Wow.
Yeah, it highlights just how difficult it is to truly bridge that gap between hypothetical choice and real-world action, or at least to formally test it.
So that's a big one. Any other limitations?
Another practical limitation is simply that any single choice experiment, any single DCE, is unlikely to be able to present all the attributes that might possibly be relevant to a decision.
Right, you have to narrow it down to 5 to 7 attributes.
Exactly. So selecting the most relevant ones requires that really comprehensive preparatory research. We talked about the literature reviews, the qualitative studies.
Which takes time and resources.
It definitely does. It can significantly lengthen the initial development phase of a study, sometimes by months. It's not a quick and dirty method if you want to do it right.
That's a great point. It requires serious upfront investment. So thinking about that big challenge, the intention-behavior gap and external validity, how might researchers try to tackle that in the future, especially in this digital health space where real-world data is sometimes more accessible?
That's where things get interesting. One potential opportunity, which was actually suggested by the authors of the tutorial paper, could be through those curated health app portals we mentioned earlier.
How would that work?
Well, imagine if, on one of these portals, the same health app could be experimentally presented in 2 or more different ways. Maybe version A has one description and set of images, while version B has different ones, based on DCE findings, perhaps.
Like an A/B test, but on the App Store presentation.
Exactly. And then, crucially, you could measure actual user behavior, like click-through rates, download numbers, maybe even installation rates using standard website or platform analytics.
So you'd get real-world behavioral data linked to the different presentations.
Precisely. That would provide invaluable real-world outcome data to directly compare against the predictions made by a prior DCE study. It could give us a much clearer picture of that intention-behavior gap in specific contexts.
That sounds like a fantastic way to potentially validate or calibrate DCE findings with real actions.
It's a promising avenue for sure, combining the strengths of stated preference methods like DCEs with real-world behavioral observation.
And that neatly wraps up our deep dive into discrete choice experiments. It's really clear that understanding what users truly value is just paramount for the success of any digital health product. And DCEs, despite their complexities, offer a powerful, systematic, and clearly evolving way to uncover those crucial insights.
Absolutely. I mean, despite those challenges we discussed, like external validity, DCEs hold really significant potential in digital health research and development. They serve as such an important decision-making tool, especially in a field where good observational data on uptake is often scarce. They really allow developers, designers, even policymakers to build tools and systems that hopefully genuinely meet user needs and encourage that much-needed uptake and engagement.
So as we finish up, here's maybe a thought for you, our listener, to mull over. Just consider for a moment how many digital products and services you interact with every single day. From social media apps to streaming platforms, maybe that new health app you just downloaded.
It's a lot.
It really is. How much of your own decision-making process for choosing and using them is consciously about those specific trade-offs we talked about? Between the features, the price, the brand reputation, the look and feel.
Do you actively weigh those things?
And then, take it a step further. If companies and researchers could more precisely predict your specific trade-offs using methods like DCEs, how might that fundamentally change the digital world around you? For better, or maybe even for worse?
Interesting question to ponder.
Definitely something to think about. Thank you so much for joining us on the deep dive today. We really hope this exploration has given you a fresh perspective on the often hidden science behind our everyday digital choices.